Good morning. Today we are going to talk about heart health for women. All right. So let me introduce myself. My name is Ange, or Anjali if you like to call me, and my profession is women's health movement coach. I am nutrition counselor. Alex is here. I am going to. What's happening here? Okay. Yeah. Hi, Emma. Yeah. All right. So I'm going to send a request to Alex. Will have to send me the request again. Oh, Alex is here.
Hello.
Alex, thank you for your time. Thank you for being here.
Thank you for having me. It's an honor to be here today with you,
Oh,
Ange.
amazing. Can't wait to talk about it. And hi, Emma. So Emma is here. If you can hear us, Emma, please give us a thumbs up so we continue with it. All right. So I was introducing myself. So I am women's health movement coach as well as nutrition counselor and the founder of this platform. Today we have amazing Alex here. So I'm going to read Alex's amazing bio. All right, Alex. Oh, would you like to? Thank you,
I've just got
Emma.
to shut my sliding door. The rubbish truck's come.
Okay, all right. Here we go. So I'm going to read the in bio of Alex. Alex is founder of HeartCore Group, Bachelor of Nursing, Masters in Critical Care. Alex has spent over 17 years in healthcare, with the last 6 years leading the large cardiac rehabilitation team in Queensland, located at Robina as a clinical nurse consultant. Alex is the founder of HeartCore Group, which leads the way in preventative heart health education, delivering presentations to workplaces, community groups, and individuals, educating on risk of heart disease and promoting behavior change to reduce cardiovascular disease. Amazing. All right. And so would you like me to talk about your services, or would you like me to just put it on the content down below, or you can talk about it? So, your services.
Okay. Thank you for that lovely introduction. Yes, I do workplace presentations at any workplace or community groups where I present cardiac disease and heart health. I also do one-on-one coaching with either business coaches or individuals. And I have my own podcast. It's called HeartCore Junction, and we talk about health and cardiac disease, but also branching into other health conditions. So that's HeartCore Junction, published both on Spotify and YouTube.
Amazing. Thank you so much for that. And before we continue with the questions, I would like to say the little bit of disclaimer side that this talk is all about to bring awareness and bring a little bit of education around heart health, and as well as support each other, Alex and myself, to bring the awareness around our services as well, right? And so this is only, and if you need support, or if you're, please go to your healthcare practitioner, or if you are, concerned about heart health, people can directly go to you, right, Alex?
Correct, correct. And my disclaimer too is that I'm not a doctor, I don't prescribe. However, I liaise with doctors and cardiologists and specialists on your behalf. So I am education only and I can help you create a healthier heart.
So earlier when we were talking before live started, we were talking about how you bridge the gap, right? Between so yeah, can you say that a little bit again?
Yeah, so my service is about preventing cardiac disease because
Mhm.
80% of cardiac coronary artery disease is actually preventable, not 10 or 20, but actually a massive 80. So, in my line of field in the past, it's always been that cardiac disease education happens reactively after you've had a heart attack, after somebody's had a stent, then they get referred to cardiac rehab. However, there is such a need to deliver this education preventatively. So when I do sit with people one-on-one coaching, or in a scenario as a guest speaker, people will come up to me and I can liaise with, I can be their go-between between a specialist
Mm,
and a cardiologist or a GP, just to say, hey, go and get this diagnostic test done, go and get this blood work done, because it'll help them help you, and then I can interpret that as well and
mm.
liaise with those specialists on their behalf.
Yeah, that's incredible that how we can prevent 80% of this cardiac health, right?
Yes, it's huge. It's incredible. And if people only knew that they could tweak a minor thing here or there, it would
Mm,
make all the difference. And really, that they are simple tweaks that people can walk away with, and
yes.
it makes all the difference. Like, even last week, there's a blood test that somebody can do that I had an elderly gentleman do because he's got massive family history, and he came back to me 2 weeks later and he says, Alex, I got my grandsons to do the test, and this marker is elevated, which puts those grandsons at 4 to 6 fold risk of having a heart attack to a person that has a normal marker.
Mm,
However, it's given, you can't change this genetic marker. However, it's given
mm,
those young men awareness to go, hey, I can't get away with the things that other people do, like drink in excess and smoking and these behaviors. So they know now that they can lead as clean a lifestyle as they can, and it's going to hold them in
mm.
really good stead.
Yes, so they can, really make that will really help them to be aware, like you have mentioned, and try to take care of themselves. And hopefully, it will make a huge difference for living healthy, healthier quality life,
Yeah,
right?
absolutely.
Yeah. All right, let's start. So the first one is, why is heart disease often underdiagnosed or overlooked in women compared to men?
There is a huge disparity between men and women. So, for example, women are reluctant to report any symptoms. There is a delayed presentation to emergency or healthcare providers. There's a delayed in diagnosis, and there's a delay in treatment to women versus men. There's even a higher
Mm,
mortality in hospital, that women die 2% and only 1.5% in men. So there's such a disparity that people don't sort of overlook. And I think women just need to recognize the symptoms that we'll talk about in a minute, and
mm,
realize that they do present differently. And a lot of the studies are based towards men. I mean, cardiac disease is predominantly 70% men. So therefore
mm.
25-30% is only women. So therefore all the clinical trials are based on men, not on women.
Not
We need
women.
to get more women aware of their symptomology.
Yes, we were talking about how the clinical trials, for women to do clinical trials is, yeah, a little bit challenging too, right? So
Women
all
don't
the
even want to come to the clinical trials. And that's a shame, because there are clinical trials just for women. And when they don't even want to come to that, but I think for a woman, their priorities is their household, it's their children's, it's their family, it's schooling, all of that. Women sort of put themselves last.
mm,
And I think through awareness and more of these conversations, we have
mm,
to make it aware that women, if you've got a symptom, go and get it checked out.
yes, 100%. So yeah, everyone listening and including myself. Yes, because sometimes I have something and it's like, oh, it will go away. So I'll be fine. That's
Yeah.
my mentality. And back home as well in Nepal, that when we were growing up, we didn't have the health, we didn't have a healthcare system to, that we could go to. And lots of times we just like, got over it, or how our body recovered. So in that mindset, I'm still trying to get better on that side. So
Good, good.
yes, I'm getting better. And my
Yeah.
GP is always, she's very thorough, so I can't get away from her. So yes. So what are some early warnings, signs of heart issues in women that we often ignore?
Right. And women have may have different symptoms to men.
Mm-hmm.
So women may experience more chest discomfort rather than the
Mm.
elephant sitting on the chest. They will have
Okay.
shortness of breath. They may have just jaw or shoulder pain or neck pain here. So they've got to recognize that they are slightly different. But also that if they are diabetic, this is a man and a woman, and
Mm.
they have any diabetic neuropathy, which is diminished nerve sensations. That's
Mm.
diminished nerve sensation in diabetes is not just to the feet, it is actually throughout the whole body. So they
Yeah.
may not even experience the chest pain at all if they are
Mm.
diabetic and they have diabetic neuropathy. So they've got to go on all the other symptoms, for example, shortness of breath, fatigue. I have shoulder pain, I have back pain, I'm feeling nauseous. I feel like vomiting. I look pale. I look clammy. I look sweaty. So try and base yourself on this umbrella term of if I have one or more of these symptoms, go and get them investigated. But definitely women can present totally different symptomology to a man.
To male. So the difference is that we might have a shoulder pain, shoulder discomfort, and the discomfort on the chest, not
Yes,
like a.
discomfort on the chest versus maybe a man might have that real elephant sitting on the chest. A
Mm.
woman might go, hey, it's chest discomfort, which is another reason why they probably have delayed presentations to ED because they think,
Mm.
oh, is that just my esophageal reflux? Is that because I'm less fit than I used to be? Is my
Mm.
shortness of breath maybe because I've put some weight on in the last few years? So they can dismiss those symptoms, but if you have one or two or more of these, because you can have one symptom, I've even looked after somebody that had pain in their pinky finger and they knew
Mm.
they were having a heart attack. So when
Oh.
you feel off and you don't feel quite right, the key is to just go and present. We would rather that you present because it's 4 hours in ED and they do all the blood work and they say, no, you're good to go, than if you delayed it. Because with cardiac, time is muscle. The longer you leave it, the more damage and heart failure you can incur. So the quicker, the
Mm.
better. We would like you in emergency and in the cath lab where they maybe put a stent in within 60 to 90 minutes.
Mm. So if there is something is off in your body, you just go straight to check it out. Right?
Absolutely, because women are very intuitive too. They know their bodies and they know them well. It's just all
Mm.
the other priorities in life, and they can tend to dismiss it. So,
Yes.
my line of thought to the women that are listening today and in your Instagram is don't delay. Time is muscle. We don't want anybody to delay, whether you're a man or a woman.
Mm, yes, that's a great sign. Thank you. So, how do hormones, perimenopause and menopause, which is a hot topic these days, affect a women's heart health?
It is a hot topic. And the reason is okay, so I ask you, do you ever see young women have a heart attack? Not really. And it's because
No.
estrogen is a cardioprotective factor.
Mm-hmm.
While women are of menstruating age, their estrogen is a cardioprotective factor. Unless they have a lot of family history and a lot of other comorbidities. And for example, indigenous Pacific Island nations, they are also at higher risk. However, you don't predominantly see a young woman having a heart attack. However, when she hits menopause,
Mm-hmm.
that estrogen level drops off and they
Mm-hmm.
start equaling the risk to a man. So, therefore, you
Mm-hmm.
start seeing women have heart attacks, say, in their 50s, 60s, 70s. And that rise in risk actually grows quite quickly from menopausal women and up to equal the men. So, that is a predominant key area. And I know with hormone replacement, I don't go there. That's for a woman to speak. Do I need hormone replacement? Do I not? Also, exercise is really good just in terms of you riding through menopause a lot easier. Is
Mm-hmm.
the studies have shown that women that do exercise regularly can ride through the wave of menopause a lot easier. However, if it is something like HRT that you're interested in, I would advise go and seek professional help with your
Mm-hmm.
GP to talk about that. But that's the reason you don't see young women predominantly having heart attack because of estrogen.
Mm. Estrogen. Okay. So it's the just that one
Yes.
estrogen.
Whereas men don't have that. They got testosterone,
Yeah.
which is not a cardioprotective factor. That's why you see men, even as early in their 30s, they are starting
Mm,
to have heart attacks. So they've got
mm,
no protection whatsoever. So we're lucky. And if you probably think of it from the caveman point of view, um, women were there to bear children, and so therefore there was no way probably in the cave woman that she was supposed to have a heart attack, because she's there as the sacred feminine being looking after the household and looking after the
mhm.
children. So maybe there is a whole lineage from genetics that does play a factor in why young women don't have a heart attack.
Yes. So then we should take us as the lucky ones, hey? Yeah.
Yes.
Yes. So that's amazing. Okay. So let's roll on to another one. What role do lifestyle habits like sleep, stress, and emotional health play in protecting our hearts?
Okay, so I'm going to leave the stress till another question. But
Okay.
if I just go through the modifiable risk factors, and I've actually written them down, but obesity, women are 50% more obese than men. Obesity is a
Mm,
massive cardiovascular risk factor. And I'm just going to read them out. Diabetes. Women are 2 to 4 times at higher risk of a cardiovascular event than men if they have diabetes. That's
okay.
huge. Blood pressure. Now, blood pressure is because, so if a systolic blood pressure, normal is 120/80. If a
Mm,
woman just goes to 130 systolic pressure, that means a lot more risk of cardiovascular disease to a man if he had a systolic blood pressure of 130 and greater, because women's hearts are physically smaller, and the very
mhm,
first thing it does is, if I can show you that red diagram, is the blood flows through there, and the very first thing it does is it turns that corner. And if you've got
mm,
high blood pressure on a very tiny heart,
mm.
that is causing more pressure on that arterial wall, which the
Okay.
heart doesn't like. So, women, it is keep your blood pressure and look at it as a massively silent killer. Nobody really does their blood pressure. You can even go to a GP and they don't do your blood pressure. So, I always recommend that you just buy one of those home blood pressure machines. And if you want to, you can always monitor your blood pressure. Don't get obsessed with it and do it 5 times a day. But just start to get to know what your blood pressure is doing. And you may need medication to do it, but there's a lot of lifestyle changes that will help you. And when we talk about the modifiable risk factors, they all interact. Exercise is the be and end all. It'll reduce your blood pressure, it reduces circulating cholesterol, it reduces your blood sugars, it elevates
Mm,
your mood. Exercise is the be and end all. So I love exercising. The heart's a muscle, it loves to exercise. The other thing is, yes, cholesterol. Women are less likely to be prescribed a cholesterol lowering medication, and they have greater incidence of muscular symptoms if they're on a statin compared to a man. So they're reluctant to be on a cholesterol lowering tablet, a woman.
mm.
Diet. Women are more prone to emotional eating than a man.
Yes.
So
Yeah.
therefore, you've got,
Our monthly cycles
yep.
and, going through all of that. And,
Which rolls into the very first one, which was obesity.
mm,
So if you're emotionally eating, there's your obesity, there's your increased waist circumference, which is again increased risk of cardiovascular disease. They all link and intertwined, all these modifiable risk factors. And if
mm,
you deal with one or two, it'll actually positively affect all the other ones as well.
mm,
Exercise, women are less likely to meet their activity levels than men. Cardiac rehab, less women go to cardiac rehab after a cardiac event. Pretty much, we would have our gyms would either be 100% full in cardiac rehab, or 1 to 2 women at the most. And
yeah.
we've only got classes of 15, but pretty much a lot of women don't go when it's crucial to go and get cardiac rehab
Mm,
after an event. Smoking, women who smoke are found at 25% greater risk of ischemic heart disease compared to a man. So there's so
mm.
many differences of men and women that
Yes.
women need to start recognizing and realizing, hey, I've got to look after my heart. It's the most sacred organ of your whole body. If the heart doesn't work, nothing works.
Mm. So when I was going to add in there because my daughter, they used to do so many physical activities when they were little. And as they grow up, they period and they, all the things, and they do less and less, you know.
Yes,
So we have to start in school, I feel like, to educate them around how we can manage, staying active and manage that as well.
absolutely. Right through to, I've exercised since I was 17. And I'm a
Mm,
lot older now. And my children were brought up exercising, and it was like that was just part of life. It was part of a daily routine, go and
mm,
exercise. So they used to end up coming first in cross country and all that right through to grade 12. They still exercise today. And my daughter's 30 and she still does boxing, gym junkie. And so it just becomes incorporated. So if we as parents with young children can incorporate exercise,
mm,
that's going to help elevate their moods. It's going to get them out of the house. It's going to show them teamwork, bonding, and all these other massive benefits. You've got to really instill exercise with your children. And you're absolutely right. The older kids get at school, I used to notice there was less kids in the cross country. There was less
mm.
kids doing after school activities.
Yes. So, yeah, we have to, yeah, I think focus more in a school sector as well to bring up this, awareness.
Yeah.
And regarding nutrition, so when people coming to you for help, so if they ask you about the nutrition, do you guide them towards someone the practitioner towards
Yes,
some
I
nutrition?
liaise with many people, but I
Mm,
also can help them with their nutrition. If they have a lot more complications, then yes, I will pass them to
mm,
a dietitian, a
okay.
credentialed, qualified dietitian.
Yeah, yeah.
And yeah, that's easy. If they're over prescribed in medications, I will pass them on to a pharmacist that I know that actually helps in de-prescribing. And she
Mm,
even mentioned the other day on my podcast, she had somebody from that she reduced from 60 medications down.
mm,
So, yes, I have my colleagues that I can rely on if I want to.
yeah, yeah. So okay. So what are the simplest and most powerful things women can start doing today to support a healthier heart? Very basic. You don't have to go to the gym. You don't have to.
No,
So yeah.
walking. Walking is great. Walking doesn't cost a cent, but I want you to walk at such a pace that if you've got the watch on, great. If
Mm,
you don't, doesn't matter. But I want you to walk at such a pace within your tolerance level that
mm,
when you come home, you go, whew, that was a good workout. So we ask for 150 minutes per week of increasing your heart rate exercise
mm,
within your toleration, and please seek medical clearance if you feel like you can't exercise or you have a chronic condition.
mm,
However, if you can just simply walk, people that can't walk that distance because of knee problems, go to a swimming pool, go to a hydrotherapy pool, start walking to increase that heart rate, because the heart is a muscle, it loves to exercise. And even if you just start off with 10 minutes, great. And it doesn't matter how you chop that 150 minutes up. You could do 30 minutes today, nothing for 2 days, an hour on Saturday, doesn't matter. But the
mm,
benefits have shown it'll actually decrease another cardiovascular event by 20-30%, which is
mm,
huge.
yeah.
And I just want to go back to stress.
Mm,
And stress, women, there's two things that women at higher risk in terms of stress. One is called Takotsubo, and that
mm.
is a heart attack. It's called broken heart syndrome,
So
and it is
Takasuba.
Takotsubo. And Takotsubo is a Japanese octopus
Mm,
jar. So what it does
mm,
is the heart actually balloons out, the left ventricle balloons out in the shape of an
mm,
old-fashioned octopus jar. And the women became in the World War II, and their Japanese fighter pilots didn't come home. They all had mimicked heart attacks, but it was actually Takotsubo. And in 6 weeks, that heart will remodel. I've looked after people, and it's a stress brought on by a stressful event, predominantly with women. I've looked after women with Takotsubo, but they were in a nursing home, asked to play the piano in front of a crowd. But that
mm,
was such a stressful event. So
mm,
predominantly more women. So again, women, look out after your cortisol levels, look after your stress levels, because the heart doesn't like chronic underlying stress. And even breathing. So a technique for
Mm.
women, find a mindfulness spot, find a room, find a quiet time away from your kids, and don't say time out children, say mum's going to have a timeout. And then go and pop yourself in a room
Yeah.
and put
It's
music
mommy
on, a
time out
book,
time.
and have time out yourself, put lovely music on and just deep
Mm.
breathing, and you'll engage that parasympathetic system and create that calming reflex. Okay.
Mm.
But the other stress thing that I want people to watch out for is it's called SCAD, spontaneous coronary artery dissection. And that's where
Mm.
one of the coronary arteries will actually dissect. Again, predominantly women in their 40s to 50s that have high anxiety, a high exercise tolerance,
Mm.
and women, and it's scared. So these women are at high risk because they're running, they're extremely fit, they think they're extremely healthy, but they've got a
Mm.
luminal tear in the artery, which then the blood is trying to get through the crack, that tear, and it clots because it blocks that artery.
Mm.
Again, it's a heart attack because you're blocking that artery. But those women have got a lot slower recovery, definitely need to go to cardiac rehab,
Mm.
and we can exercise them at 60% of their maximum heart rate.
Mm.
But that's a very sad one. But it's again, women, you don't have to do over the top exercise. Moderate 60 to
Mm.
80% exercise is enough.
Yes. Yeah.
And for women, yes, eat cleanly, lots of fruit, veggies, lean meats. Stay
Mm.
away from sugar. It's so inflammatory. Your heart
Mm.
doesn't like inflammation at all. Sugar is inflammatory. So if you can get rid of sugar from your diet, and especially if you do have diabetes, then you've got to watch the fruits. Just lots of salads, veggies, lean meats. And lean meats, I say, is white meat, fish or chicken with the skin off. Even red
Mm.
meat has got higher saturated fat than a white meat. Yeah.
Mm.
So even if
Okay.
they could adopt those two things, and exercise would be great.
Mm. So it's interesting that when we overdo it, right? I was uh, I was one of those people because I came from eating disorder background. So every time when I'm doing exercise, I'm looking at not thinking how good I feel. I'm looking at the number on my watch, like how
Right.
many I am, ticking off, how many I have done today, and
Right.
then only last year I realized that I was getting burnt out. But because I wasn't focusing on, I want to feel good in a sense and live healthier life and quality life, then looking at the number that, and then, breaking that cycle of that it is not about the number. You are enough. You want to live quality life, and like you were talking about this is so important for people like myself, that you don't want to get the scad, you said.
Yeah.
Yes.
Scared. And
Mm.
what I want to emphasize with women too is this is the more spiritual side, but the heart is the most sacred organ of the whole body. It
Mm.
has the biggest electromagnetic field of the
Mm.
whole, any organ in the body. And you can simply hop onto Heart Math, and they've
Mm.
done hundreds of studies showing that we all have a frequency electromagnetic field that emanates beyond our body, but we need to listen to our hearts. And we're
Mm.
so in our heads with these busy lifestyles, Ange, that
Yes.
we're not listening to our hearts. And our hearts talk to us every single day. In fact, the
Mm.
heart talks to the brain more than the
Mm.
brain talks to the heart, along afferent nerve fibers and
Mm.
efferent nerve fibers that run from the brain back to the organs. There's 90% more nerve fibers running this way than there is this way. So I ask and beg the question, who's the boss? It's not the
Mm.
brain. So we need to get out of our heads, and we need to
Mm.
listen to our heart, because I can guarantee you, if every listener could just say, what's my heart telling me now? What's the one modifiable thing I can change right now,
Mm,
today? And your heart will tell you, and just go and do it. Because I've assessed thousands of people and pretty much try to ask them, hey, did you ever have an inclination that you needed to change something? And you know what
mm,
they'd say? Yeah, I knew I should have started exercising. I told my wife we should do this. And so therefore that intuition from the heart is talking to them, but we're too busy to listen. And so it knocks that little bit louder and it goes, oh, you need to make a change. And we still don't
mm,
listen, to the point that it gives us a cardiac event like a heart attack. And then we go, oh, okay, ready to listen now. But
mm,
what if we could prevent that now by going into your quiet zone again? Find your just mindfulness time and start listening. That's the
mm.
message I want to
Yeah.
give.
And mindfulness doesn't have to be like a half an hour or, long, long time, right? When
No,
yes.
it can be
So,
you walking, you going for your jog, whatever you do. Exercise kicks in those endorphins as well
mm,
and gives you that same relaxing feeling. But instead of people that I see walking and they're walking with their heads down, looking at their mobile phone, stop, look around you, be present in the moment. Look at the trees, look at the park, look at the swans. Breathe that in and just
mm,
find your parasympathetic system, which is your rest and digest, and bring that level down. Get out of your left brain, get into your right brain.
mm. So I start because I work from home, right? And I start putting 15 minutes timer on my watch. So every 15 minutes, I have to get up and do breathing or look out the window or, just deep breaths and do some jumping jacks or just movement a little bit, every 15 minutes. But yeah, I think we all can do that, little things like that, to help us get out and practice that mindfulness. I know sometimes it's like, oh, too busy. Oh my God, this timer going off
See?
again.
See, because we're in our left brain, thinking, 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 too
Yes.
busy. We need
Yeah.
to make that time and make a pledge to yourself today to go, I'm going to change one
Mm,
thing for my heart health. If the heart is the boss. If it doesn't work, nothing works.
yeah. We are, yes, we have to take care of our heart. All right. So, okay, that brings us to the last one. Well, we finished our all the questionnaires. If anyone has any question, please put it in the comment section. Alex would love to, come reply you. And then while we wait, Alex, please tell us, where can people find you?
Right. They can hop onto my website. It's www.heartcore group, all one word,
Mm, yeah.
HeartCore group.com. If they
Yes.
want to contact me, there's a contact button on there which will
Mm-hmm.
send an email to me. Alternatively, they can just email me straight, which is info@heartcoregroup.com.
Mm-hmm.
And I
Okay.
would love people to look at my podcast. It's called HeartCore Junction. It's
Mm-hmm.
on Spotify and YouTube. Please like, share, and subscribe to that would be great. And I do have my own Instagram account, heartcore.group.
Yes. So hardcore dot junction, is that the Spotify?
No, it's just Heartcore Space Junction on Spotify and YouTube.
Okay. Yeah. Okay.
And then the Insta is
Yeah.
heartcore.group.
Okay. So that's amazing. So I would like to put all that in there. Is it on your website? So I can put all that in the
Yes. Yeah.
content. Okay, I'll grab that from there. All right. So okay. So if anyone who will watch the recording video, please, if you have any questions, please send a message to Alex and she will be available to reply to you. And if you like to collaborate with her, she'll be an amazing person to talk about the women's health, cardiac health, and you do the public speaking and all those things, right? So that would be amazing. And yes, and if anyone would like to connect, yeah, just contact directly to Alex. So
Lovely.
yeah. All right, Alex. Thank you so much for your time today. And yeah, we will catch up soon.
Lovely. Thanks very much for
Thank
having me.
you. Thank you,
Thanks,
everyone,
Ange.
for being here. Thank you so much.
Thank
Bye-bye.
you. Bye.
Bye. Bye.